when you think about artificial intelligence for healthcare, what opportunities or benefits come to mind first?
Yeah, so I think AI in healthcare is like an emergent use case. You see basically a few use cases already, like radiology scans is a pretty interesting one, like AI as a surgical assistant. But also broadly, even before sort of patients get into the surgical room, you have like AI receptionists for like medical practitioners or like a dentist's office or for a GP, a general practitioner. Everything that can make it easier to access healthcare, but then improve the sort of actual healthcare delivery, so like actual like healthcare outcomes afterwards. So there's lots of opportunities. I think though this happens a lot in like entrepreneurship, like private sector bringing it in. But for example, in the UK, a healthcare system that is very slow and inefficient is very slow to also adopt AI systems and to use AI for good, which is a bit of a risk and something I think that's a blocker that I think more entrepreneurs and more people are trying to solve to bring AI in.
To expand a little bit on that, what concerns, if any, do you have about AI being used in healthcare decisions or medical systems?
Well, there's two things. One is about trust, right? So I think the big issue is whether or not humans trust in AI systems to make critical judgments around health, which is obviously like high consequence, right? In that. So I think it's a question of how do you create trust, and right now, because you know AI is trained off like data that may or may not be have certain biases. I think there's a trust gap around like trusting AI to be put in these the most high consequential decisions, right? So I think that's bucket one. I think bucket two is around like a similar idea of just you need a human in the loop. So I think the sense is that if you're just letting AI again take these high consequence actions by itself, who's responsible? Who's going to be accountable for it, right? Is it the doctor who decided to use this AI system? Is it the patient who signs a sort of waiver? So I think there's all these like unclear, untested sort of issues of AI in healthcare. But also, again, there's so much opportunity because all of these use cases are new. And if we reach a point where AI reaches like this general intelligence, healthcare is one of the areas where we could see the biggest gain in terms of not just, again, healthcare delivery, but also just in like foundational science, right? In terms of like AI for cancer research, AI for like new drug discovery. And that's going to be huge, right? That would completely transform the whole concept we have on longevity as well. So it's a big opportunity. A lot of it is just unresolved. Not yet. People are trying to figure it out.
Yeah, so do you believe AI should ever make medical decisions without human oversight? Why or why not?
I think no, in the sense again, one is a perception issue. It's like you need some person that you can trust, and you need some interface of like accountability, and a human is going to provide that. I think where AI can do its best work in healthcare is this angle that it can again help triage, for example, help make processes easier for medical practitioners, like people coming into a clinic, you can streamline the sort of administrative process. But I think where AI lags behind is again that like medical expertise, but also judgment that extends beyond pattern recognition. Right? A lot of the system is trained on just like what's happened before, therefore like we extrapolate what's happening after. It's good at identifying these type of like hard edge problems where you know there's an answer. But a lot of cases in medical practices or beyond, there's a lot of these fuzzy cases. You need some level of human ingenuity. So I think until we reach a point where there's maybe a general intelligence system where we say AI is better in almost all domains of human cognition, people will feel safer, there will be more accountability if there's a human in the loop, which I think is a better way to have like human AI collaboration anyway. So yeah, I'd say it doesn't make sense until maybe like a decade maybe when there's trust, but also there's some way that we know that AI systems are actually better in not just pattern recognition and these simple stuff, but actually, making these like more qualitative judgments on it.
We've gone over a little bit about this next question, so you can talk a little bit more if you want to or yesterday. So who do you think should be held accountable if an AI system in healthcare does make a harmful mistake? So it could be the developer, the hospital, the doctor, or someone else.
Yeah, that's the golden question. I think it's really tough. I'd say everyone has some like degree of accountability, but at the end of the day, I think it's up to the doctor or the medical practitioner because I think the developer could build in safeguards or like guardrails and everything. but I think they will acknowledge to some extent and have some neighbors that are like, well, you know, this is not a perfect product, yada yada. So I think it's therefore the user, in a sense, the medical practitioner, who decides to take on the risk, knowing what risks are involved in using an AI system, and then making a judgment based on that. And I think policy is going to frame around this as well. Right? It's like, well, the developer creates a range of like exemptions, like a lot of disclaimers. And at the end of the day, if you're choosing to take on that risk as a medical practitioner, either to take on more patients, either to do things more efficiently, when things go wrong, which they will do, you have to take on that responsibility. Right? There's upside, there's downside.
Yeah. And there's a big discussion on this right now. It's hard to place blame on one system. Thank you for your opinion. Then the last two questions are a little bit about. So firstly, do you think young people currently have influence in society?
I'd say yes and no. Yes, in the sense that I guess it depends how you define young people. Innovations and progress is coming from very young entrepreneurs, right, from the Valley or elsewhere in Europe, where they're producing these very novel assistants, either let's say LLM in like administration for like medical clinics, for example, or I know one that's more doing like foundational science, that's like AI for medical research. And a lot of these are basically founded by people in their 20s or maybe even early 30s. So there's, I think, a specific opportunity for this like novel, new way of thinking process that young people have. But I think from a governance standpoint, I think a lot of this will fall down to industry, from the sort of medical sector itself, also to like broadly like AI industry, and I think those are still very gate-kept institutions, right? A highly regulated environment. So I think for a young person to really influence that is quite tough, unless they do so from like a market-based perspective, like launching a new product or showing like cost effectiveness or showing like better patient outcomes or some very practical sentiment. So that's my take. I'm sure there's work being done on the policy level.
And lastly, what is one policy, safeguard, or change we believe should be implemented to ensure AI is
I think it's probably down to that accountability question, and that raises the stakes, right? So if you're saying at the end of the day, no matter what the AI system or developer is, if you as a medical practitioner decide to use AI for your practice, for like your work, there has to be accountability for all to you. I think some aspect of that will create this environment where there's just higher stakes, right? You have a vested interest in ensuring that you understand the AI system that you're using, you're understanding the application and the use case, and that you hold ultimate responsibility and make a judgment. And as a result, I think that will help people not outsource maybe their judgment to AI completely, rely purely on systems, but have some degree of saying, okay, this is the advice from this AI system, or this is what the AI system identified, combining it with like traditional methods or just, again, human judgment. I think it's probably just the best way to go, again, for the near future.
Okay. That's all the questions there was.
Amazing.
Thank you very much for your time.
Thank you so much.
Yeah.